Welcome, Red Pandas, to your reveal, for want of a better word. So I want to welcome you all here tonight. I'm also like to welcome so many, what I would like to call investors here, lots of family members. You're also baggage handlers over the next few months, and you will also probably discover tonight, in the moments of euphoria, that there's a couple of extra dogs and cats to go home. I also assume you're here because the weather is very cold somewhere else, and it's not out of love for your loved ones. But welcome. My name is Sean Callan, and I'm proud to be the Dean here at Ross. Ross exists for 40 years, and 6,000 of you have gone through this before. So you've got it. You have got it. You may feel anxious, you may feel worried, and that'll build over the semester, but you've actually got it and you will be successful. Now, you're probably all feeling a little bit of pressure. The biggest pressure up here on the stage is the buttons on my jacket because I've put on a few pounds since COVID, so I'm going to loosen it for a second. A few things I just want to say to you is that you're now heading into the next phase of your educational experience. You are all going to AVMA accredited schools, which have wonderful faculty like we have here. They have wonderful support teams. They're underpinned by a rigorous education that delivers on the competencies of AVMA. And they're underpinned by the 11 standards, which are pretty rigorous, of the AVMA. So you're all going to somewhere wonderful. Will experiences vary for you? Absolutely they will. You may find the love of your life. You may find someone you never want to see again. You may find a wonderful professor that will inspire you to take on a particular discipline. You may find a wonderful professor who will inspire you not to take on a particular discipline. So you're all going to get wonderful, different educational experiences. And the only person in the way of that will be you. So I want to encourage you every moment to soak everything in like a sponge. An additional technique or attribute will be very important when you get to clinics, and you're already doing a little bit of that now. And that's a significant amount of self-awareness. I didn't get by on my academic record. I got by on other things, whether it be being self-aware of what will work in a room, what won't work in a room, having the ability to communicate. All of these are extremely important when you get to clinics. Yes, you'll need to know what you've been told here by professors, but you've got to augment it with many of the other skills. Whether you call them soft skills, I do not believe they are soft skills. I think they're really important skills. So it's so important that you think about that when you get to clinics. And that will be one of the keys, not only to success in the clinics, but also success in your future profession. So you're going to be here for another few months. It's not over yet. I hope you enjoyed tonight. I hope you have a wonderful time. Have some quality weekend time. You owe it to yourselves. You've got this far. And come back refreshed on Monday morning with your eye on the ball for the next few months. So thank you. Welcome. So I'd now like to introduce you to the MC for the night, the hostess with the mostest, and that's Dr. Larry Patance.
Good evening, red squared pandas. I'd like to once again welcome you, family, and friends to the May 2023 clinical placement ceremony. Y'all look fantastic tonight. Wow. Let's start off by saying a few words about our sponsor for this evening, National Veterinary Associates. National Veterinary Associates is a leading global veterinary community of more than 1,500 veterinary hospitals and pet resorts united in the love of animals and the people who love them. Rooted in culture of compassion, innovation, and collaboration, National Veterinary Associates champions the advancement of veterinary care and provides the support and opportunities veterinary and pet care teams need to deliver exceptional care to pets and their families. National Veterinary Associates has lived by the servant leadership model since their founding. This commitment means they prioritize their people and work diligently to ensure they have the tools, resources, and care they need to do the jobs they love with the utmost attention and quality. Now, I'd like to introduce Dr. Julia Quinn Williams. Dr. Williams is a 2018 Ross graduate and completed her clinical rotations at the University of Minnesota. She currently resides in Fayetteville, North Carolina, where for the past 3 years, she has been managing DVMs for National Veterinary Associates at Cape Fear Animal Hospital. Her special interests include anesthesia and pain management, internal medicine, business management, and leadership. In her free time, she enjoys spending time with her family, playing with her young daughters, and walking her 3 dogs. Please welcome Dr. Julia Quinn Williams.
Hi, everybody. Can you hear me? Gosh, like it's so surreal for me to be back here and see you guys because I was sitting right over there where she is in the very back row, the first in, like looking through my envelope. I think we were all kind of like, oh, do you see it? Do you see it? Do you see it? So I was there. I was where you guys are, and it's amazing. I'm so excited to be here. You know, I work for an amazing company, NVA, and they're obviously sponsoring you guys tonight. And we're so happy to be doing that. There are so many things that I want to tell you. Like I could sit here for hours, truly, and just talk to you about, you know, little pearls, tidbits, what to expect. You know, ease your confusion, ease your worries, your anxieties. But you know, those things are kind of part of this process as well. And this is probably the most exciting part of your path. And this is a phase, like Dr. Callinan said, you know, this is just the beginning. This isn't an ending. Your clinical year is an incredible experience. I may have told a few people that it feels a little bit like slave labor at times, which, you know, it really depends on the rotation. It depends on your professors, who inspires you. Again, who may inspire you to do something else. I've had those experiences, but there are so many people that have gone into clinics being like, I'm doing small animal. Like my husband, for instance, who I met on the island, he was like, I'm gonna do small animal, traditional this, and he is now a turkey veterinarian. So you just never know. I think it's so important to go in with an open mind, you know, and see what you can learn from anybody and everyone. Your techs that are going to be at your schools are so knowledgeable. Your faculty, your administration is there for you. And I bet you guys are thinking, you know, am I prepared? Do I have the skills? Will I fit in? You know, and these are all things that we have all experienced. And, I'll tell you from my firsthand experience that as a Rossi, like I went in and I had such incredible skills that Ross had provided me that I had also provided for myself. I worked very hard through the program. Ross is a rigorous program, which I know I don't have to tell you guys because you're living it. But know that it's rigorous for a purpose, and they are setting you up for success. And you are all going to be so successful. And I am just so excited for you guys of the things you're going to learn, the personal development you're going to have. On those 12, 13, 14-hour shifts, I want you to keep that perspective. It is stressful. I mean, studying for NAVLE and doing rotations is no joke. If you have a family on top of that, that's also no joke. So know that it is a struggle and everybody struggles. Obviously, if you're struggling more than you anticipated, talk to somebody about that. But I think part of that struggle is the experience, is that personal growth. And there's nothing else like it. So it's going to be the best, probably the most challenging year of your lives, but you're going to have so much growth. And again, I promise you have the skills. You absolutely do. Actually, you have more than the skills to get by. I remember like visibly on my anesthesia rotation, and I went to the University of Minnesota. I should have said that for my clinical year. And it was an amazing school, but as a Rossi, I was above and far above a lot of their anesthetic knowledge and application. And that's one thing that you guys are so lucky to get. You get so much application here through all of your skills, all your EVS, and even the knowledge your professors have provided. So I hope you're very excited. And I know you can't see that yet, but you'll see that when you get to your programs. And just know that you can do it. Continue to work hard. And know that you are representing a bigger person. You are not only representing Ross, but you are representing, veterinarians as a whole. And, we're so excited to have you guys because, we need reinforcements. We need more vets. We're in high demand. But, being a veterinarian comes with a large level of responsibility. And that being, we're educators. We're a lot of different things, but at the forefront of it, we educate people, and without education, there's a lot of things that can't be done. But know that you guys have the education, and I know it doesn't really mean anything, but I am so proud of you guys to have gotten to where you are. Because if anybody understands it, even though it was like 5 years ago, I still have some stress dreams. I'm actually not joking. I had one the other night that I never left the island. No, seriously though, I really I told my husband, who was 2 semesters ahead of me, he was actually red semester. I was blue semester, but it doesn't go away. This experience doesn't go away. You literally carry it for the rest of your time. So really just embrace it, enjoy it, and in 6 years from now, you're gonna be having those same stress dreams probably. But I hope you wake up and and smile and realize you're not there and how far you've come. So again, I'm very proud of you guys, and thank you for letting me talk. And part of what my job is contracts and mentorship. So if you guys have any questions or any way that I can help you guys, support you in any way that you need, maybe just make you feel better about anything through this whole process. I've done it, I've been there, I lived it. It was tough, but I learned so much. I made so many friends, and I'm really excited for you guys. So please enjoy it, and thank you again for having me.
Thank you, Dr. Quinn Williams. Our next speaker and another RUSVM alum is Dr. Julie Rhea from Iowa State University. Dr. Rhea graduated from Ross University School of Veterinary Medicine in 2014 after completing her clinical year at Purdue University. She is a native Michigander and completed her undergraduate degree at Michigan State University. Dr. Rhea first came to Iowa State as a rotating intern in 2014. After completion of her internship, she went into private practice emergency medicine before returning to Iowa State University as a clinical assistant professor in the intensive care unit, where she has worked for the past 7 years. She has recently moved into a new role within the surgical education curriculum at Iowa State University, but remains involved in the clinical year education. Please help me welcome Dr. Jolie Rhea.
Thank you, Dr. Patance. Dr. Patance was my surgical instructor. So I'm still a little bit terrified, so you'll have to give me a second. Congratulations, guys. This is super exciting. I know you're very anxious to open those envelopes, and I can't understand because I only got an email to tell me my clinical placement. So this is awesome that you guys have this celebration for such an exciting time. I want to reemphasize that, of course, I'm biased. I currently work at Iowa State, and you'll see me if you come to Iowa, but any of the clinical schools tonight will prepare you for your future as a veterinarian. You need to embrace your clinical year as you've embraced the last 2 years on St. Kitts. I always say there's something to learn from every single case. You just have to figure out what it is, even if it's those soft skills that we talk about. There are so many opportunities in front of you, and you need to make sure that you take advantage of all of them. We are all a part of the Rossi family. And now that I have children and married, I do feel a sense of pride when I come back here, and I do feel like we're kind of all a family. And soon we're going to become colleagues. As a family, we need to make sure that we take care of each other. So I challenge you to reach out to your colleagues and your Rossi family in times of struggle. Our profession is known for being mentally taxing, and every once in a while, we just need to be reminded of how awesome and amazing Rossis are. Thank you very much for having me. Being back on this campus brings back a lot of memories of some of the best times in my life. I know you guys are going to make us proud, being a part of the Rossi family in clinics, and I can't wait for you guys to figure out where you're going to be going tonight. So, all right. Thank you.
Thank you, Dr. Rhea. Our third speaker this evening is Dr. Jerry Ritchie from Oklahoma State University. In 1987, Dr. Ritchie completed his Bachelor of Science in Microbiology, and in 1991, completed his DVM from Oklahoma State University. After a short stint in small animal practice, he joined North Carolina State University, completing a residency in anatomic pathology in 1993 and a PhD in immunology in 1997. Dr. Ritchie was certified as a diplomat in the American College of Veterinary Pathologists in 1996. Following training, Dr. Ritchie joined the faculty at Oklahoma State University, where he has served for the past 25 years in teaching, research in infectious disease, and as an attending pathologist for the Oklahoma Animal Disease Diagnostic Laboratory. Dr. Ritchie currently serves as the Associate Dean for Academic and Student Affairs and is the current president of the American College of Veterinary Pathologists. Dr. Ritchie and his wife, Carrie, have 3 kids, all in the U.S. military, and 2 grandkids. In his spare time, Dr. Ritchie and his wife spend a lot of time at the lake, and he is the front man for a pathology rock and roll band, ACVP, a horrible ripoff of AC/DC. Please welcome Dr. Ritchie.
Yeah, usually when there's this many people in front of me, I have a guitar in my hand and a band behind me. So it's my pleasure to offer congratulatory remarks to you all. I know this is an important day, probably one that many of you had marked on your calendar from day one. I know that none of you are going to remember my name. Few of you are going to remember what I say. Uh, but I hope all of you will remember I was at least brief. So, three things: past, present, and future. Let's say that together. You guys ready? Past, present, and future. All right, you got the past. Please have all the confidence in the world that you guys are prepared to go to wherever it is you're going. I swear you to God, you guys are ready. You've got a top-notch education from Ross University, from some of the best faculty that we have in veterinary medicine. Indeed, many of them internationally recognized in their disciplines or field of interest. You guys are ready, okay? And so have confidence. How about the present? When you reach your clinical placement, I want you to dive right in. Answer the questions, speak up at rounds, volunteer for procedures, be the person that takes that difficult inpatient. You are going to do or say something that's wrong. Just, you will. I do every day. And I've been doing this for 30 years. If you don't make a mistake, you're not learning. Don't be afraid. Dive right in. Now, in the future, when you graduate and you move beyond this place, never stop learning. You must remain a contemporary professional. Continuing education, wet labs, journal articles all await you, except then no longer will you be graded with quizzes, exams, and practicums, but you will be judged by your character, your integrity, and most of all, your competence. Veterinary medicine changes daily. You must keep up with it. Do not practice in 2035 like it's 2024. So remember, have confidence. Number two, dive right in. And number three, never stop learning. Go Pokes.
Thank you, Dr. Ritchie. So we're a little bit ahead of the game tonight. So you're not going to clap after this. I thought what we could do is take some time and make sure that you guys have still been practicing your Rossi skills. So just give me a minute. So who's going to volunteer to go first? I bet you all thought you'd never see this thing again. I better take it off before you throw rocks at me or something. I had a student once tell me, Dr. Batance, you know, you'd be a whole lot less intimidating if you had hair. Like I got a choice. Anyway, we'll move on. Now I'd like to invite Red Semester class representatives, Miss McKinney Heilecker and Mr. Robert Hutto, to say a few words.
Finally.
Yes, we finally made it here. You guys, I can't believe we're all here.
Please give yourself a hand. Like you're here. You made it.
We are here to celebrate tonight. And we'd like to thank all of our family, friends, and the faculty for coming here tonight or watching from home to celebrate this milestone with us. Thank you for all the support you've given us throughout this entire journey, because we all know that we wouldn't have made it this far without you.
We would also like to thank our fellow classmates for the opportunity to be the voice of our class. We're very proud to be a part of such an inspirational group of future colleagues. Thank you for the memories and for creating this island family that we have today with one another. The friendships we have made here will last us the rest of our lives.
I'd like to ask all of you, our classmates, just take a moment to reflect. Take a deep breath, because it may be the last chance you get this semester. It's been a long journey, and it has seemed to drag on and fly by all at once. From meeting each other online in our first semester and navigating international travel during a pandemic, just to make it in time for lockdown. Somehow making it through both semesters of anatomy without a single live practical. Surviving earthquakes, hurricanes, centipedes, and sleeping through morning lectures just to catch up on Panopto together that afternoon. We faced it all as we worked towards our shared title of DVM.
Clinical placement has been a thought in our minds since first starting here at Ross. Every sleepless night, hours of studying, watching Sam Devine's recordings on 2x speed before the block exam. We love you, Sam. And countless coffees from rituals have led us to this moment, the night that begins our planning for our next and final step of our academic journey, clinical year. When you get to your clinical year in your clinical school, I hope you do not forget Ross, faculty, and professors. They have put so much time and effort into shaping you into the clinician that you will become.
We have overcome many challenges already, the ones that we have shared as a class and many struggles that we have faced as individuals. And while there are still many more challenges ahead of us, we are here tonight because every single one of us has proven time and again that we can rise to the challenge and that we have what it takes to earn that title of doctor.
We first came together almost 2 years ago from all corners with the same goal, and very soon we will be scattered to the wind or whatever airline you choose. We hope that wherever you land, remember that you earned your place there in your role in this profession. Don't allow anyone, especially yourselves, to sell yourself short. Like Dr. Little has been stressing to us every morning, say everything with confidence. You know more than you think, and you would not be here at this moment if you were not meant to be. If there is one thing I hope you leave this island, it is to leave with the confidence that makes you all shine.
We hope that you all get a chance to celebrate this weekend, but don't get too crazy. Morning soaps will wait for no one. And as we push on through the rest of this semester, we hope that you don't forget where we all started, right here on this little rock in the West Indies. It's been an honor to share this experience with you all. Félicitations, nous avons Chris.
Felicidades, Lolo Cramos.
Congratulations, we made it.
Thank you, Ms. Heileker and Mr. Huta, your class representatives. So, about 35 plus years ago, long time, huh? I was just starting my senior year at my undergraduate institution, and I had an appointment with my faculty advisor. We sat down, and the appointment was basically to talk about if I was going to go on, to postgraduate studies, if I was looking at potential career options. And I told the advisor that I really wanted to go to veterinary school. I was a good student. I had good grades. I wasn't a great student. So the faculty advisor looked at my academic profile, looked at my transcript, and looked me straight in the eyes and said to me, "Have you ever thought about an alternative career?" Fortunately, I didn't take that advice. And most of you probably don't know this, but I was one of you. I was in my last semester right here at Ross University, waiting to go to clinics. And in those days, we didn't have choices. There was one option, right? But it was this institution, this university, that gave me the opportunity and the education to become the veterinarian that I aspired to be. I want you guys to look back on all your accomplishments thus far. Each and every one of you must have had a successful undergraduate career in order to get accepted to an AVMA accredited veterinary institution. Each and every one of you has successfully completed 6 semesters of a very challenging veterinary curriculum. And each and every one of you has been successfully presented to and accepted into an AVMA affiliate institution. So with that said, I wish you the best of luck in your 7th semester, the best of luck in your clinical education, and may you all go on to have a successful veterinary careers. Thank you. Now I'd like to say a few words about Dr. Erica Little and then ask her to come up to the podium. Dr. Little is our Associate Dean of Clinical Affairs and Professional Opportunities. Dr. Little completed her Bachelor of Science degree from Colorado State University and her veterinary degree from Kansas State University. She then went on to complete an equine residency at Auburn University and became board certified by the American College of Veterinary Surgeons in 2007. Upon completion of her residency, she practiced as an equine surgeon in Nevada for 6 years. In 2013, Dr. Little joined the RUSVM faculty as an associate professor of large animal surgery. I cannot stress how vital her role is in creating and maintaining relationships with our clinical affiliates and how important her role is in the entire clinical placement and administrative process. Please welcome Dr. Little.
I have to bring it down a little. Thanks, Dr. Batans. It's great to see the red squared pandas. So before we go on, we're so close, very close, like 45 more minutes. Before we go on, I do want to just acknowledge all of the work that Dr. Batans put into what's in all those little envelopes there. You've all had 1 or 12 meetings with Dr. Batans over the last semester. And I'm going to make a certificate. There's got to be some sort of Tetris expert level certificate of all your needs, all your wants, all the things that go together to place you guys in your affiliate institutions coming up here in 12 weeks. So soon. Panic. You're fine. Just be confident. That's the theme of tonight, right? I can ask some questions if you want to practice your confidence. Anatomy. All right. So anyway, thank you, Dr. Batans. It's a lot of work, so we appreciate it. So while we were sitting back here listening to all these amazing speakers for this evening, I'm watching you guys and seeing the kind of, before we started, people were really obviously like, And then now since the speeches started, it's kind of like, maybe I can see this. So I would caution you against that. Some of you may know about this tradition. And so it actually started way back with Dr. Ryan Kavanaugh. And the envelopes have been programmed. It's kind of a giant pain, but it's a thing now, so we do it. So they've been programmed that if there's too much attention, too much handling, etc., the information inside can change electronically. You'll probably be able to palpate a little chip in there at the bottom of the envelope. I'm waiting for some of you to do that because it really is there. And so with that whole tradition, it was passed down to me, and I really enjoyed carrying it on because it's important for you guys to just wait for 30 more minutes. But tonight's an exciting night. You guys are so close. You finished 6 semesters, like Dr. Bertans was saying, only 3 3/4 of a semester left. So something along those lines. If you're the stats person, I probably did the math wrong. So we're about to have a toast. So most of you still have full glasses, so that's a win. So before we go through the toast, there's a few logistics that I have to go through and I have to read so I don't screw them up. So we'll do the toast, and then we'll have a countdown for the toast, 3, 2, 1. You can open the envelopes. We'll do the toast, open the envelopes, and we'll give you a few minutes to celebrate. And this is where it gets important. We're going to do the timer for celebrating because it then takes several minutes, like bring y'all back. So we'll give you a few minutes to celebrate, and then we'll reconvene. By reconvene, it means you come back to your seats when we come up here. And at that time, Dr. Bucknoff will call your name individually with the others and your affiliate. So whichever affiliate you're going to, she'll say the names of the students, of all of you going to that affiliate. And as she does that, we'll have a procession. So as your name is called, you'll leave and go up either side, and then you'll meet kind of in between upper and lower odd over here. Dr. Bertans will be up there, so you can just find Dr. Bertans, and he will help guide you. Once all of your fellow classmates going to that same affiliate are together, you guys can make a procession in front of the camera for your family and friends to see back at home, for those who can't be here joining you in person. So, and after that, you'll go up to the back of the room, continue your procession to the back of the room, and you'll go outside and have your picture taken. All right, so please follow. There will be folks helping you, telling you where to go. Please follow them, get your picture taken. And then Avenel is amazing and was able to put together a 360 camera for you all after that. So I'm looking forward to seeing that on Facebook next week. And so the 360 camera will be there just past the student union, if I'm not mistaken, after your official pictures. Okay. And also there's some excellent food prepared for you by Papa to pick up as well on the green, and kind of remind you of that as we go. So when Dr. Bucknoff calls your name, she will also call the faculty advisor, who is sort of your go-to person for that affiliate. They are generally somebody who either did their clinics there, taught there, went to school there, or some other way knows that area really well. So these faculty advisors from Ross are meant to help you maintain your connection. If you have questions, if you don't understand something in the area, is there a great place to eat? Is there a good neighborhood that you want to go to? What's rent like? What were your favorite things? So they're an excellent source of information for you from that perspective. And so if your advisor was unable to join us this evening, because not everybody was able to make it, they will be reaching out to you probably in the next couple of weeks. So you will hear from your advisor either by email, WhatsApp, some sort of electronic method. They will reach out to you and your team and help you kind of get prepared for your clinical year. And so with that, are you guys ready? All the logistics are done? All right, guys, you ready? Okay, so we're going to do the countdown. We'll have the toast, and then we'll give you 5 minutes. I will watch the clock and reconvene. So remember, you have to come back into your seats. So, right, the moment you've been waiting for. Clinics is going to be one of the hardest, probably the hardest year of vet school, but it will be so, so worth it. And we know that you will all make us so proud and are going to do extremely well. So, cheers. All righty. 3, 2, I'm waiting for everybody to get their glasses back down. And 1. everybody. I gave you 1 extra minute. Come on back. Congratulations. All right. The sooner you sit, the sooner you can do the 360. Okay. So, guys, as we move forward, Dr. Bucknoff has the distinct pleasure of reading your names. And I promised I would put in a plug for your ER ICU rotations and that you should all do extra rotations in that. Is that right? Yeah, okay. All right. So you'll stay seated until you hear Dr. Bucknoff call your name. When you hear your name, you're going to go back. There's Dr. Bertans. All right. So you'll go up there and wait for the rest of your cohort. And then you'll do your procession. That's a hard word for me tonight, apparently. And then you'll follow the instructions like we talked about. They're waving up there in the back to help you guys along your way. And from there, once your picture is taken, you guys are free for food and 360 and the rest of the weekend. LAS, Monday morning, 8 a.m. Just a little plug. So, and I just want to say before Dr. Bucknoff does come up and release you all, I just wanted to thank NVA for their sponsorship tonight. It's greatly appreciated. They've come a long way to celebrate with you, so thank you. I also want to thank Dr. Ritchie from Oklahoma State and Dr. Rhea from Iowa State for all their time this week and helping tell our whole school a little bit more about some of the affiliates that we have, about their own school, what it's like, so that when you don't believe me, you can see it, they're real. So thank you both for being here. I also want to thank the entire RUSVM staff and our IT personnel, our caterers for the evening, Paw, and Avenel Foy, our clinical coordinator, who has worked incredibly hard to ensure that everything about this evening went off without a hitch for you guys and created a wonderful celebration. So thank you all. All right, Dr. Bucknoff.
All right, thank you, Dr. Little. I just have one important question. Dr. Ritchie, is ACVP going to be performing later? You can't just say something like that and not like give us a little taste. All right, excellent. Well, I'll start this like I start all my lectures. Hi, guys. Hi. And hello, home audience. So I was really honored when you asked me to read the names and be part of this ceremony tonight and be part of the Red Panda experience. And then I looked through your names and realized that you really must all despise me. just kidding. But there are some doozies and I'm going to do my best. But after that glass of champagne, no promises. All right, so without further ado, just like Dr. Little said, I'm going to call out your school and your faculty representative, and then you're going to hear your name, and then you're going to congregate by Dr. Batance, and he's going to, I don't know, high-five you or something. And then you're going to pass by, say hi to the camera and the home audience if you'd like, and then exit out the back, and we'll kind of just keep that going. Any questions? That'll be on the test. Okay. All right, so starting with Auburn. Auburn. All right. And you are lucky enough to have Dr. Erica Little as your faculty advisor. All right, who's going to Auburn? Maria Chardon Suarez. Mackenzie Gose. Tyler Lusk. And Melissa Vilgatz. Congratulations, Auburn. All right, next on our list, we have the one and only Colorado. All right, you guys may have to invest in some winter clothing. You're lucky enough to have faculty advisor, Dr. Sarah Kavanaugh. All right, so we'll start with Tyler Brzezowski. I know the applause was for my pronunciation. Mitchell Canada. Summer Foyle. Juliana Renzi. And Sari Stein. All right. Congrats on Colorado. Next up, we have Cornell. It's also pretty cold there, so just make sure you come prepared. Maybe some snow boots, maybe like a snow shovel in addition, maybe one of those automatic car starters, just in case it's too icy. All right, who's going to Cornell? Justin Formenton. Alyssa Pallin. All right, you'll have to keep each other warm. Cornell is lucky to have you. Cornell. Go Big Red. And your faculty advisor is Dr. Rob Gilburn. All right, next up, we have Edinburgh. So make sure to renew your passports. Dr. Carrie Rolfe is your advisor. And we have Annika Johnson. Accompanied by Savannah Earhart. We hope you come back with accents. All right, so our next clinical affiliate, there's going to be quite a few of you, and don't sell your sunscreen just yet because you're going to Florida. And Dr. Ryan Kavanaugh is going with you. I'm just kidding, he's your advisor. All right, starting with Jessica Bloodgood. Caitlin Clark. Brenda Cotto Lopez. Hannah Dawson. Irini Gergis. Thank you. Jenna Holmes. Noah McCullough. Samantha Maroff. Brianna Mottenbolt. Anastasia Parashis. Megan Scott. And Martina Williams. All right. Watch out for gators. Watch out for snakes. Seriously, keep your dogs on a leash. All right, congratulations on Florida. All right. So next up, we have Illinois. And Dr. Hillary French is your faculty advisor. And Illinois is also very lucky to be getting quite a few of you, starting with Crystal Ackenreel. And Natalie Arenas. Thaddeus Chapman. Zenaida Gonzalez Sandoval. Robert Huto. Daniel Kim. Ashley Lozada Almeida. Jessie Ann Rivera Leon. Juliana Santiago Loza. Kristen Serrano. And followed by Marissa Yeaman. Congratulations, you're going to Illinois. All right, so next up we have Iowa. Iowa will be lucky to be getting 3 of our soon-to-be clinical students, Edmarie Enrique Mercado, Heather Federo, and Adriana Pribble. And your faculty advisor will be Dr. Andrea Peda. Congratulations. All right, so now let's move down to Kansas. Who's going to Kansas? And Dr. Erica Little, again, will be serving as your advisor. She's a busy lady. All right, starting with Emily Brammer. Jasmine Encarnacion. Kervins LaRouge. Jeremy Rube. And Leanne Tiopenko. Kansas is lucky to have you all. Congratulations. All right. Next on our list, we have Lincoln Memorial University. And your faculty advisor, again, will be Dr. Hillary French. All right, so let's start off with our soon-to-be doctors, cool. Austin. I've been waiting all day to say that. Austin and Amanda Cool. All right. Accompanied by Alana Goldie. And Ashley Hennessy. Yevgenia Koshta. And Haley Tabor. Congratulations. All right, our next affiliate is also very lucky to be getting quite a handful of you. All right, we have LSU in Louisiana. Louisiana and Baton Rouge. All right, Dr. Kimberly Stewart will be your faculty advisor. You probably won't need winter clothing. All right, we have Nevada Gemin. Adivet Alfaro. Sadie Bowling. Jennifer Burns. Yuran Chow. Justin Chang. Mariah Condoleo. Louis Feole. I'm trying. Kaylee Hagberg. And Savannah Langley. Madison Lorenz. Natalia Melcher Lopez. Hannah Passman. Iman Samra. Samantha Valdez. And Alice Yang. All right, Louisiana doesn't even know what's coming. Congratulations. All right, moving back up north, we have Michigan State. Michigan State is next. And your faculty advisor will be Dr. Renata De Rosario from our clinic. All right, who's going to Michigan? Starting with Kirsten Colton. Sydney Jones. Megan Kessel. And Joseph Klein. Congratulations on Michigan. All right. Our next clinical affiliate, oh, you'll definitely need to bring a sweater, Minnesota. And your faculty advisor will be a Ross alum, Dr. Aaron Burton. Starting with Abigail Dial. And Deja Samuels. And Emmanuel Torres. And again, I can't emphasize this enough. Please keep each other warm. Congratulations. All right, now let's move down to Missouri. All right, Missouri will be lucky enough to have Clayton Fisher. And Samantha Mintz. And Sina Sadeji. And Michael Schmidt. All right, enjoy Missouri. Next up, we have Montreal. There's so much pride. Our very own Dr. Helene Larda will be your advisor. I love it. And she brought props. I love it. All right, Vincent Lavertu, you're up. Congratulations. Now I want to go there. All right. Next up, we have North Carolina State. And I happen to be your faculty advisor. It's where I did clinics. It's near and dear to my heart. It was one of the best years of my life. Maybe it was actually the best year. It's actually a year and a half. I don't have time for the story. But I was lucky enough to stay and do some research. Anyway, congratulations. You're going to NC State. Emily Ban. And McKenna Hilliker. Hope Nasiper Merriman. And Brenda Rivera. I'll tell you about all the good places to go hiking. Lots of fun. Oh, yeah, and exactly. Yep, you can come. Yep, an hour south of Fort Bragg, right? Exactly. So we'll see you after class for the details. Congratulations, NC State. And you can wear all your red while you're there. All right, the Ohio State is next. I know enough to say that. All right, who's Ohio lucky enough to have? Tiffany Anderson. Monica Anzalone. Emily Katoy. Evelyn Patient. And Christy Romo. All right, congrats on the Ohio State. All right, next up we have a school called Oklahoma State. All right, who's going there? Your advisor is Dr. Nicole Abramo. And we'll start with Madison Boone. Natalia Burgos Vasquez. Ryan Hart. And Eric Jensen. Madeline Jocelyn. Madison, I'm sorry. I've been trying my best. Madison, I apologize to friends and family. Shannon Leonard. Adrian Newball Diaz. Gabrielle Reese. Caitlin Robinson. Martin Stafford. Allison Sterling. And Christopher Strange. All right, congratulations on Oklahoma. Maybe you'll get Dr. Ritchie to perform for you while you're there. Next up, we have Oregon State. Dr. Alini Vieira will be your advisor. Ryan Abershami. Cicely Dupree. Megan Skirpak. Marissa Sobel. Congratulations on Oregon. All right, who's next on our list? The one and only Purdue. Your advisor is Dr. Adam Silkworth. All right, starting with Kayla Smith. Accompanied by Glennis Biblo. And Cassia DeMello. Ashley Owens. Berlina Tan. Christine Wallenberg. And Cassandra Zafrani. Congratulations. All right, we still have a handful of schools left, so stick with me. All of you. Our next one, I also want you to come back with some accents. We have the Royal Veterinary College. And your advisor will be Dr. Renata De Rosario. Starting with Megan Mishich. And Jose Rios. Congratulations and cheerio. All right. Next is Tennessee. You'll have to replace some of that red with orange, starting with Samantha Deck. And Julia Heath. Skylar Eisenhower. Desiree Jones. Anna Marco. Kira Moosemuller. Catherine Oakes. Ashton Tarrant. All right, congratulations. All right, next up we have Texas. Who's going to Texas A&M? The Lone Star State, but you'll have each other because 2 of you will be going, and your advisor is Dr. Karnick. We have Elizabeth Graffinia. And Annie Lynch. I hope you have some cowboy boots. All right. All right, the next school, also near and dear to my heart. I spent 4 of my pretty years there, just kidding, at Tufts University, where I did my residency. I'll also serve as your advisor, and you will need a jacket. All right, who's lucky enough to go to Tufts? Christopher Biancaniello. Frederic Arve. Morgan Payne. And Jacinth Ringe. I put that into Google Translate just like you said on the sheet. Congratulations, Tufts is so lucky to have you. All right, back down to Virginia Tech. Again, your faculty advisor will be Dr. Karnick. We have Brooke Chauner. All my former TAs are leaving. I don't like this. All right, Laura Fox, congratulations. Virginia Tech is lucky to have you both. All right, down to our last affiliate, but certainly not least, just last alphabetically, we have Wisconsin. Also not known for being warm, but known for being really great. All right, Rachel Crawford. Sasha Ferrari. Ariana Watson. And Kirsten Wykowski. We are so proud of all of you. All right. Good luck in clinics, and it has been a pleasure.
Thank you, Dr. Bucknoff. Thank you to all the family and friends that joined us here in person tonight, and all of you back at home. Thank you for joining. This concludes our placement ceremony for January 2023. Good night.